Perhaps the biggest hit to the president's credibility in this whole mess has been self-inflicted. Tonight, Chief National Correspondent Jim Angle with another presidential guarantee gone wrong.
In an effort to deflect the criticism for having made the false promise that people could keep their plans and doctors no matter what, the president offered a new promise.
Most people will be able to buy better plans for the same price or even cheaper than what they've gotten before.
That's not an accurate argument. So if your plan is now covering a bunch of things that you don't need, then how is it a better plan for you?
You can do the math. Most of the policies in his claim could spend more, cover more things, provide more visits, and charge less, so the arithmetic just does not work.
And the promise that most people would be better off is sharply disputed by many, including a number of individuals experiencing sticker shock, even those with pre-existing conditions.
I went from $891 a month to $1,437 a month, and also my deductibles all doubled.
I would get the terrible plan with the $6,000 deductible. So I'll pay $1,200 a year for that, and I'll be less insured than I am today.
And analysts argue those whose policies are canceled will get coverage, but not at lower prices.
What we're seeing is that the new Obamacare plans typically have higher deductibles than the old plans did, a narrower choice of doctors and hospitals, and yet higher premiums.
It's very easy for a bronze plan to have a deductible that's and total out-of-pocket costs that are $6,000.
And one analyst points to a November 14th letter from one of the top officials implementing the law, conceding subsidies won't help everyone.
It's a letter from Gary Cohen to state health insurance commissioners saying that while many people will have subsidies, there still will be some people who will be paying more than they were paying.
And a few days after his initial promises, the president seemed to downgrade the pledge that most would get better coverage at lower prices.
There's a good chance that they'll be able to buy better insurance at lower cost.
In fact, one insurance plan that asked not to be identified analyzed its pool of 375,000 people and found that even after subsidies, only 10% would actually see a decrease in cost, while 1/3 would face significant rate increases as a result of Obamacare. Brett?
More of this at the panel. Jim, thank you.